Hi friends, presenting a case of neuroenteric cyst with intramedullary extension. G2 para 1 referred at 35 weeks of gestation for a second opinion scan for a thoracic cyst. What we see in this ultrasound is a well-defined anechoic lesion which was seen in the posterior mediastinum of the right hemithorax, measuring 2.8 into 2.6 centimeters in size. The rest of the thorax was absolutely normal and rest of the baby showed a very important finding in the vertebra, which were showing us mismatch of the ossification centers. There was a curvature abnormality, and I'm sure we are looking at a multi-level segmentation anomaly which was involving the cervicodorsal spine. On a 3D reformatted image, what we see is a blocked vertebra involving the lower cervical and upper dorsal vertebrae. Now, whenever we do such a kind of scan and when we're looking at a posterior mediastinal thoracic cyst in a fetus and you have an associated vertebral anomaly, our search needs to be more powerful. And what we see here is a well-defined intraspinal cystic lesion measuring 1.3 into 0.6 centimeters, which was seen within the spinal cord at the level of the cervicodorsal junction. So, we were dealing with a neuroenteric cyst with intramedullary extension, and we know that it's a very rare anomaly, and where you find this is normally seen as extramedullary, but only 5% are intramedullary. These can cause compression on the spinal cord, thoracic duct, trachea, and esophagus. So the take-home points from this particular case is that whenever we see a thoracic cyst in a posterior mediastinum with associated vertebral anomaly, possible coexistent intravertebral component should be meticulously looked for. The outcome depends upon the extent of the displacement and functional impairment of the surrounding organs. Thank you. Please like, share and subscribe my channel.